India has launched the biggest vaccination drive in the world. It claims to have developed the most cost-effective vaccines under the sun, which it says will be instrumental in eradicating the deadly disease. New Delhi has approved 2 vaccines and aims to inoculate as many as 300 million citizens in the next 5 to 6 months. India has also said that it is committed to helping its neighbours that are dependent and are waiting for others' progress.
India, the first country in South Asia to launch a vaccination drive, and not one but with 2 vaccines, is pursuing a country-wide mission at war footing that aims to inoculate first 30 million prioritized citizens in a few weeks. First to get the vaccine will be 30 million health and other frontline workers, followed by about 270 million older than 50 or deemed high risk. Earlier this month, the country's drug regulator had cleared AstraZeneca's locally branded Covishield, an indigenous co-vaccine developed by Bharat Biotech and Government Institute. The country is also working at developing other vaccines that are at the different trial stages. The government has already bought 11 million doses of the Covishield shot and 5.5 million of Covaxin. Prime Minister Narendra Modi, who has lauded the efforts of all those who have been involved in the entire exercise of developing the vaccine, acknowledged that India had a far bigger challenge in comparison with other countries.
दुनिया के 50 देशों में 3-4 सप्ताह से वैक्सीनेशन का काम चल रहा है। करीब करीब 1 महीना हुआ, लेकिन अब भी करीब करीब 2.5 करोड़ लोग ही वैक्सीन हो पाई है पूरी दुनिया में। उनकी अपनी तैयारियां हैं, उनका अपना अनुभव है, उनका सामर्थ्य है, वो अपने तरीके से कर रहे हैं। लेकिन अब भारत में हमें अगले कुछ महीनों में ही लगभग 30 करोड़ आबादी के टीकाकरण का लक्ष्य हासिल करना है। इस चुनौती का पूर्वानुमान लगाते हुए ही बीते महीनों में भारत ने बहुत व्यापक तैयारियां की।
The observers have time and again said that Indian role in immunizing the world is going to be the most important, as the country has a legacy of providing safe and cheaper medicines, and a vaccine with only those attributes can ensure an immune world, including some poor Asian and African countries. Even in the COVID-19 vaccines, the price difference between those of India and others is expectedly significant. While the cost of the vaccine has been kept as low as $3 in India, the United States and European Union are paying much higher prices for one dose. The owner of the Serum Institute of India, the largest vaccine producer by volume in the world, says that lower prices of vaccines will help pace up an effective fight against the virus. However, he intends to sell it at a higher price in the private market.
So we've given a special price of 200 rupees for the first 100 million doses only to the government of India. On their request, that we want to support the Aam Aadmi, the poor, the vulnerable, the healthcare workers and all of that. And after that, we will be selling it at 1,000 rupees in the private markets. And of course, to the government of India, we'll still maintain a very reasonable price, but it'll be a little bit more than 200 rupees, which is our cost price.
India's eastern neighbours, Bangladesh too, will be getting Covishield vaccine dose at an affordable $4. India says it has already started receiving vaccine orders, but will take a call on export only after a few weeks. Apart from Bangladesh, India is expected to provide vaccine support to Nepal, Bhutan, Sri Lanka, among other South Asian nations. It will be exporting vaccines to the rest of the world in subsequent stages. Meanwhile, the positivity rate has been encouraging for the people and the administration as the country has been recording a consistently low number of cases. The government says it has been able to flatten the curve owing to sustained restrictions with citizens' continued support. While the mortality rate of India was always amongst the lowest, its low infection rate has provided it a shot in the arm against the disease. However, if Prime Minister Modi's cautionary words are to be followed, there cannot be any carelessness until all are vaccinated.